Sarah's morning started like any other Tuesday in her small apartment overlooking the busy downtown street. She had been working late into the night again, preparing for her presentation at the marketing firm where she worked as a junior executive. The coffee maker gurgled to life as she stumbled toward the kitchen, still wearing her oversized pajama shirt and fuzzy slippers. At 26, Sarah had built what she considered a successful life. Her apartment was modest but clean, decorated with plants she somehow managed to keep alive, and artwork from local artists she discovered at weekend markets. She lived alone by choice, having ended a 3-year relationship 6 months earlier when she realized she and her boyfriend wanted completely different futures. The morning sun streamed through her windows as she scrolled through her phone, checking emails and social media, while her toast browned. Everything seemed perfectly normal, until she felt a strange tightness in her chest. At first, she dismissed it as stress from work. The presentation she was giving that afternoon could potentially land her the promotion she had been working toward for 2 years. But as she reached for her coffee mug, the tightness intensified. Her breathing became shallow and rapid. Panic crept into her thoughts as she realized something was seriously wrong. Her hands began to shake, and beads of sweat formed on her forehead despite the cool morning air coming through her open window. Sarah had always been healthy. She exercised regularly, ate well most of the time, and had never experienced any serious medical issues. This feeling was completely foreign to her. She tried to sit down on her couch, hoping it would pass, but instead, the sensation grew stronger. Her neighbor across the hall, David Chen, was someone she had only spoken to in passing. He worked as a paramedic and often came home at odd hours due to his rotating shifts. Sarah had always found him friendly, but had never really taken the time to get to know him beyond polite hallway conversations about the weather or complaints about their building's ancient elevator. David was 31 and had been working as a paramedic for 8 years. He had moved into the apartment building about a year ago after his divorce was finalized. His ex-wife had kept their house in the suburbs and he needed a fresh start somewhere closer to the hospital where he worked. The apartment building was nothing fancy, but it was clean, affordable, and only 15 minutes from his job. That morning, David had just finished a particularly difficult 12-hour shift. They had responded to a serious car accident, helped deliver a baby in the back of an ambulance, and dealt with 2 cardiac arrests. He was exhausted but also too wired to sleep immediately, as often happened after intense shifts. He was sitting on his couch, still in his uniform, drinking a protein shake and trying to unwind when he heard a faint knocking on the wall between their apartments. At first he thought it might be the building's old pipes or perhaps someone doing early morning repairs, but the knocking seemed irregular, almost desperate. David set down his drink and listened more carefully. The sound was definitely coming from Sarah's apartment next door. He had noticed she was usually quiet in the mornings, often leaving for work around 8:30 with her coffee in hand and her phone pressed to her ear. The knocking became more frantic. Without hesitation, David grabbed his medical bag, which he always kept ready by the door, and walked into the hallway. He knocked gently on Sarah's door. "Sarah? It's David from next door. Is everything okay?" From inside, he could hear labored breathing and what sounded like someone trying to speak but struggling to form words. His medical training kicked in immediately. He tried the door handle and found it unlocked. "I'm coming in," he called out before slowly opening the door. He found Sarah sitting on her kitchen floor, her back against the refrigerator. Her face was pale and she was breathing rapidly and shallowly. Her eyes were wide with fear and she was clutching her chest. "Can't breathe," she managed to whisper between gasps. David immediately knelt beside her, setting his medical bag down and pulling out his stethoscope. His voice became calm and professional, the same tone he used with patients during emergencies. "I'm here to help," he said softly. "Can you tell me what happened?" Sarah tried to explain about the tightness in her chest and how it had gotten worse, but speaking made her breathing even more difficult. David could see she was hyperventilating, which was making her symptoms worse. He gently placed his hand on her shoulder. "Look at me, Sarah. I need you to try to slow your breathing down. I know it's scary, but I'm going to help you through this." David quickly assessed her vital signs. Her pulse was rapid but regular, and while her breathing was fast and shallow, her airways were clear. Based on his experience and her symptoms, he suspected she might be having a panic attack, but he couldn't rule out other more serious conditions without proper medical evaluation. "We need to get you to a hospital," he said, reaching for his phone to call for an ambulance. But Sarah grabbed his wrist weakly. "Don't want to go alone," she whispered. The fear in her eyes reminded David of his own sister, who had suffered from anxiety attacks during college. He remembered how terrified she had been during her first episode, convinced she was dying. "You won't be alone," he promised. "I'll come with you." As they waited for the ambulance, David continued to monitor Sarah's condition while trying to keep her calm. He noticed family photos on her refrigerator and asked about them to distract her and encourage slower breathing. "That's my sister Emma," Sarah managed to say, pointing to a photo of two women at what looked like a graduation ceremony. "She lives in California now." "Tell me about her," David said, checking Sarah's pulse again while keeping his voice conversational. The simple act of talking about someone she loved seemed to help Sarah focus on something other than her frightening symptoms. David had learned that distraction could be a powerful tool in managing acute anxiety, though he still needed to ensure this wasn't something more serious. When the ambulance arrived, David's colleagues immediately recognized him. "What do we have, Chen?" asked Maria Santos, a paramedic he had worked with many times. David quickly briefed them on Sarah's condition and symptoms. As they prepared to transport her to the hospital, Sarah reached for David's hand. "Please," she said quietly. Without hesitation, David told his colleagues he would meet them at the hospital. He quickly locked Sarah's apartment with the spare key she indicated was hidden under a plant and followed the ambulance in his own car. The emergency room at St. Mary's Hospital was unusually busy for a Tuesday morning. David had been to this particular ER countless times during his career, but being there as a visitor rather than on duty felt strange. He sat in the waiting area, still wearing his paramedic uniform, watching the controlled chaos of medical professionals handling various emergencies. Sarah had been taken into an examination room immediately upon arrival. The attending physician, Dr. Rebecca Walsh, was someone David knew and respected. She was thorough and compassionate, exactly the kind of doctor he would want treating someone he cared about. Through the partially open curtain, David could hear Dr. Philip Walsh questioning Sarah about her medical history, any medications she was taking, and the events leading up to her episode. Sarah's voice was steadier now, though still shaky. The oxygen they had given her in the ambulance had helped significantly. "Have you experienced anything like this before?" Dr. Scowrod had died, Walsh asked. "Never," Sarah replied. "I've always been healthy. I exercise regularly, don't smoke, barely drink." This came out of nowhere. "Doctor." Walsh ordered a series of tests, including an EKG, chest X-ray, and blood work to rule out cardiac issues, pulmonary problems, and other potential medical causes. While they waited for results, she explained to Sarah that her symptoms could be caused by several different conditions, including anxiety disorders, but they needed to be thorough. David found himself thinking about Sarah differently than he had during their brief hallway encounters. He had always noticed that she seemed driven and professional, always rushing off to work or returning late with takeout bags and a tired expression, but seeing her vulnerable and frightened had revealed a different side of her personality. When Dr. Walsh emerged from the examination room, she spotted David and approached him. "You brought her in?" she asked. David nodded. "She's my neighbor. Found her having difficulty breathing in her apartment this morning." "Good thing you were there, Dr. Cowell," Walsh said. "Her vitals are stable now and the preliminary tests look normal, but we're still waiting on a few results." "Has she mentioned any recent stresses or changes in her life?" David realized he knew very little about Sarah's personal life. They had exchanged pleasantries about work in general terms, but he had no idea what specific pressures she might be facing. "I honestly don't know much about her situation," he admitted. "We're neighbors, but not close friends." "Dr. Don," Walsh nodded understandingly. "Wow, she's asking for you!" "Would you like to sit with her while we wait for the final test results?" Inside the examination room, Sarah was sitting up in the hospital bed, looking much better than she had a few hours earlier. The color had returned to her face, and her breathing was normal. She was wearing a hospital gown and had an IV line in her left arm. "How are you feeling?" David asked, taking the chair beside her bed. "Embarrassed mostly," Sarah said with a weak smile, "and grateful. I don't know what would have happened if you hadn't been there." "You would have been fine," David assured her. "You managed to call for help by knocking on the wall. That was smart thinking." Sarah looked down at her hands. "I was so scared. I really thought I was dying. I've never experienced anything like that before." David had seen this reaction many times in his work. The fear that accompanied a first panic attack was often overwhelming, especially for people who had never experienced anything similar. "The unknown is always frightening," he said. But you handled it well considering how scary it must have been. They sat in comfortable silence for a few minutes, listening to the sounds of the busy hospital around them. Sarah finally spoke again. I keep thinking about what might have happened if I had been alone somewhere else. What if I had been driving or in an important meeting? Those are normal concerns, David said, but try to focus on the fact that you're okay now. Whatever caused this episode, it's treatable. Sarah studied David's face. Despite her frightening morning, she found herself noticing details about him that she had never paid attention to before. He had kind brown eyes and an easy way of speaking that made her feel calmer. His presence was reassuring without being overwhelming. "Can I ask you something?" Sarah said. "Of course. Do you ever get scared doing your job, dealing with emergencies all the time?" David considered the question carefully. "I think fear keeps me sharp. If I wasn't at least a little afraid of making mistakes, I might become careless. But the training and experience help me function even when situations are frightening." "That makes sense," Sarah said. "I guess I'm not used to feeling out of control of my body like that." Dr. Walsh returned with Sarah's test results. Everything had come back normal, which was both relieving and puzzling. "Your heart is healthy, your lungs are clear, and your blood work shows no abnormalities," she explained. "Based on your symptoms and these results, I believe you experienced a panic attack." Sarah frowned, "But I wasn't feeling particularly anxious about anything. I mean, I have a presentation at work today, but I've done dozens of presentations before. Panic attacks don't always have obvious triggers," Dr. Walsh said. "Sometimes they can be caused by an accumulation of stress that we might not even be consciously aware of. Have you been under any unusual pressure lately?" Sarah thought about it. The past few months had been intense at work. The promotion she was hoping for would mean significantly more responsibility and longer hours. She had been working late most nights, skipping meals, and hadn't taken a real vacation in over a year. "I suppose work has been pretty demanding lately," she admitted. "Physical stress, even from positive challenges, can sometimes manifest in unexpected ways," Dr. Walsh explained. "I'm going to recommend that you follow up with your primary care physician and consider speaking with a counselor who specializes in anxiety management." The idea of needing counseling made Sarah feel uncomfortable. She had always prided herself on being strong and independent. "Is there medication for this?" she asked. "There are several treatment options," Dr. Walsh said, "but I'd like you to start with some lifestyle modifications and stress management techniques. If episodes continue or worsen, we can certainly discuss medication." She provided Sarah with information about breathing exercises, stress reduction techniques, and warning signs to watch for. She also cleared Sarah to go home but recommended taking the rest of the day off work. "I have that presentation this afternoon," Sarah protested. Both Dr. Walsh and David looked at her with concern. "Sarah, you just had a medical emergency," David said gently. "Your health is more important than any presentation. But this presentation could determine whether I get promoted. I've been working on it for weeks," Dr. Walsh intervened. "I understand this feels important, but pushing yourself when your body is telling you to rest could potentially trigger another episode. Is there someone who could cover for you or reschedule?" Sarah realized they were right, but the thought of missing such an important opportunity was almost as anxiety-provoking as the morning's episode had been. She called her supervisor and explained that she was having a medical issue and would need to postpone the presentation until the following day. As they prepared to leave the hospital, David offered to drive Sarah home since she hadn't brought her car. During the ride, they talked more than they ever had before. "Thank you for staying with me," Sarah said as they pulled into their building's parking garage. "I'm glad I could help," David replied. "And Sarah, if you ever need anything, even just someone to talk to, I'm right next door." For the first time that day, Sarah's smile reached her eyes. The weeks following Sarah's hospital visit brought unexpected changes to both her life and her relationship with David. What had started as a medical emergency had evolved into something neither of them had anticipated. Sarah did deliver her presentation the following day, and despite her fears, she received the promotion she had been working toward. However, the experience had given her a new perspective on what truly mattered. She began implementing the stress management techniques Dr. Walsh had recommended and started seeing a counselor who specialized in anxiety disorders. Jennifer Kim, Sarah's new therapist, helped her understand that her panic attack had been her body's way of signaling that she had been pushing herself beyond her limits for too long. Through their sessions, Sarah began to recognize patterns in her thinking and behavior that had been contributing to her stress levels. Success isn't worth sacrificing your health, Dr. Kim explained during one of their sessions. True success includes taking care of yourself so you can sustain your achievements long term. Sarah started making small but significant changes to her daily routine. She began eating regular meals instead of grabbing snacks between meetings. She scheduled time for exercise and actually kept those appointments with herself. Most importantly, she learned to recognize the early warning signs of stress before they could escalate into panic. David, meanwhile, found himself thinking about Sarah more often than he expected. He had always been focused on his career and had assumed that his failed marriage meant he wasn't ready for another serious relationship. But something about the way Sarah had trusted him during her most vulnerable moment had affected him deeply. He began timing his morning routine to coincide with Sarah's, often encountering her in the hallway or lobby. These interactions led to longer conversations over coffee and eventually to David offering to cook dinner for Sarah one evening. "I should warn you," he said as he unlocked his apartment door. "My cooking skills are pretty basic. Paramedic cuisine usually involves things that can be heated up quickly between calls." Sarah laughed. "That's still better than my usual dinner of takeout or cereal." David's apartment was surprisingly cozy. While Sarah's place was decorated with plants and artwork, David's had a more minimalist feel, but was warm and welcoming. As they prepared dinner together, Sarah found herself relaxing in a way she hadn't in months. David was easy to talk to, and he listened without trying to fix everything or offer unsolicited advice. "Can I ask you something personal?" Sarah said as they chopped vegetables for stir-fry. "Sure. You mentioned you were divorced. Do you mind talking about what happened?" David paused in his chopping. "We got married young, right out of college. I thought I knew what I wanted, and so did she. But as we grew older, we realized we wanted completely different lives. She wanted a traditional suburban life with kids and a house with a white picket fence. I was passionate about my work and wanted to travel, maybe do medical volunteer work in other countries someday." "That sounds like fundamental incompatibility rather than anyone's fault," Sarah observed. "Exactly. We spent 2 years in marriage counseling trying to find a compromise, but some differences can't be bridged. We finally realized we could either stay married and both be miserable, or divorce and give each other the chance to find happiness with people who shared our respective visions." Sarah appreciated his honest and mature perspective on his failed marriage. It was refreshing compared to some of the bitter, divorced men she had dated, who seemed to blame all their problems on their ex-wives. "What about you?" David asked. "You mentioned a relationship ending recently." "Similar story, actually. We dated for 3 years and he kept pushing for us to move in together and start planning a wedding. But I realized I was staying with him because it was comfortable and expected, not because I was excited about building a future with him specifically." That must have been a difficult realization. It was. Breaking up with someone who hadn't done anything wrong felt cruel, but staying would have been crueler to both of us. As their friendship deepened, Sarah began to notice how much calmer she felt around David. His presence was soothing without being boring, and he had a way of putting things in perspective that helped her manage her anxiety. One evening, about 2 months after her panic attack, Sarah had been working late on a particularly stressful project when she felt the familiar tightness beginning in her chest. Instead of panicking, she used the breathing techniques Dr. Kim had taught her and knocked gently on David's door. "I'm having some anxiety," she said when he answered. "Could we just talk for a few minutes?" Without hesitation, David invited her in and made her some chamomile tea. They sat on his couch, and he guided her through the breathing exercises he had learned during his medical training. "Breathe in slowly through your nose," he said softly, demonstrating. "Hold it for 4 counts. Now breathe out slowly through your mouth." As her breathing normalized, Sarah felt grateful not just for David's help, but for how much their friendship had grown. "I think I'm falling for you," she said quietly, surprising herself with her honesty. David set down his teacup and looked at her carefully. "I'd been hoping you might say something like that, but I didn't want to pressure you. You've been through a lot of changes recently." "This feels different from anything I've experienced before," Sarah said. "With my ex-boyfriend, everything felt like it was following a script, like we were together because it made sense on paper. But with you, even just sitting here drinking tea feels meaningful." David reached for a hand. "I feel the same way, but I want to make sure we're both ready for this. You're still working on managing your anxiety, and I'm still figuring out how to trust relationships again after my divorce." They decided to take things slowly, continuing to build their friendship while acknowledging their growing romantic feelings. Sarah appreciated David's patience and understanding. He never made her feel fragile or broken because of her anxiety, but he was always supportive when she needed help managing it. 6 months later, Sarah's anxiety had become much more manageable through therapy, lifestyle changes, and the support system she had built with David and a few close friends. She had learned to recognize her limits and respect them, which had actually made her more effective at work rather than less. David had started taking some of the volunteer medical missions he had always talked about. With Sarah's encouragement, their relationship had grown stronger as they supported each other's individual goals and growth. One morning, almost exactly a year after her first panic attack, Sarah woke up in her own apartment feeling peaceful and rested. She could hear David moving around in his kitchen next door, probably preparing for his early shift. She knocked on their shared wall, but this time it was a gentle, rhythmic pattern they had developed as their own private code. A moment later, she heard his responding knock. When she opened her door, David was standing in the hallway with 2 cups of coffee and a smile that made her heart flutter in the best possible way. "Good morning, beautiful," he said, handing her one of the cups. "Good morning," she replied, thinking about how much her life had changed since that frightening Tuesday morning. What had started as a medical crisis had led to the most meaningful relationship of her life. Sarah had learned that sometimes the scariest moments could lead to the most beautiful transformations, especially when you didn't have to face them alone. As they stood in their building's hallway, sharing coffee and planning their day, Sarah felt truly grateful for the panic attack that had brought David into her life in such a profound way. She had gained not only a loving partner, but also a deeper understanding of herself and the importance of taking care of her mental and physical health. The fear she had felt that morning seemed like a lifetime ago, replaced now by a sense of contentment and excitement about the future they were building together.